What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my anatomy playlist. In previous videos, we talked about the anatomy of the head, anatomy of the neck, anatomy of the thorax, of the abdomen, of the pelvis and perineum. We talked about anatomy of the upper extremities, lower extremities, neuroanatomy, and even embryology. In the past several videos, we talked about the arteries of the pelvis, which are the branches of the internal iliac artery, the venous drainage of the pelvis, and today it's time to talk about the nerve supply of the pelvis, particularly the pudendal nerve, which runs in the pudendal canal, together with the internal pudendal artery and with the internal pudendal vein. Click the like button, click the subscribe button, so this knowledge does not go in vain. This is my anatomy playlist. Please watch these videos in order. If you have watched my neuroanatomy playlist, you would recall that your nervous system is made of central nervous system and peripheral nervous system. The central nervous system is your brain and your spinal cord. That's it. How about the peripheral nervous system? It's anything that comes out of the brain, i.e. peripheral to the brain. We call these the cranial nerves. Or anything that comes out of the spinal cord, i.e. they are peripheral to the spinal cord. We call these spinal nerves. So the CNS is brain and spinal cord, whereas the PNS is made of cranial nerves and spinal nerves. Here is a common mistake among students. Students think that cranial nerves are part of the CNS. That's not true. Just because something is located in the cranium doesn't make it part of the central nervous system. Get your head out of your sphincter. Your nervous system has a structural unit and a functional unit. What's the structural unit of my nervous system? It's called the neuron. How about the functional unit? Is the reflex arc with stimulus, receptor, afferent, center, efferent, effector organ, and response. The neuron is made of a soma or a cell body and an axon. If you wish to see more videos like this in the future, drop a brain emoji in the comments. Here's the soma, here's an axon. A collection of somas in the central nervous system is termed a nucleus. So when you have a soma and another soma next to it and another one beside it and another one and another one, and they make a family, this family of somas is known as a nucleus, as long as the family is in the CNS. But what if the family of somas is in the PNS? That's called a ganglion. Next, a collection of axons in the central nervous system is known as a tract, such as the corticospinal tract, spinocerebellar tract, pyramidal tract, extrapyramidal tract, and all kinds of tracts. How about if we have a collection of axons in the peripheral nervous system? That's what you call a nerve. So today when we talk about the pudendal nerve, what do you mean by nerve? I mean a bunch of axons running together until they supply the pelvis and perineum. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. Here is another classification for the nervous system. Your nervous system is somatic or autonomic. Somatic means voluntary, something that you can control, but autonomic means visceral or splanchnic or involuntary, something that you cannot control. Somatic could be motor or sensory, autonomic could be motor or sensory. To learn more about the pelvis and perineum, watch my video titled Anatomy of the Pelvis and Perineum, which you can find in this anatomy playlist, or better, you can find it in my 90 minutes quick review playlist, where I review every single topic of anatomy on 3 videos. So there is part 1, anatomy of the thorax, known as quick review, part 2, anatomy of the thorax, that's the ultimate review, and part 3 is clinically oriented anatomy of the thorax, and I repeat the same process for every region in anatomy, including neuro and embryology. And I have review videos for physiology, for biochemistry, molecular biology, genetics, pharmacology, pathology. I cannot forget microbiology. There is a video for general micro review, gram positives, gram negatives, viruses, fungi, and human parasitology. as well as the systems. I have 2 review videos on cardio, 2 on neuro, 2 on pulmonology, 2 on endocrine, 2 on heme, 2 on onc, 2 for immuno, 2 for rheum, 2 for kidneys, 2 for GI, 2 for skin, 2 review videos on the eye, 2 on the ear. Then we have infectious diseases, geriatrics, EKG, and emergency medicine. If you want review videos on these particular topics, please let me know in the comments. Plus some review videos for surgery, pediatrics, obstetrics and gynecology, as well as psychiatry. You can find these videos in my playlist titled In 90 Minutes Quick Review. For example, in my Anatomy of the Pelvis and Perineum review videos, these are all the topics that we talked about in these review videos. Today we'll focus on the nerve supply of the pelvis. Innervation of the pelvis and the perineum, let's go. Remember the lumbar plexus and the sacral plexus. Lumbar plexus has 2 very famous nerves that you cannot forget. Obturator nerve medially and femoral nerve anteriorly. How about posteriorly? Wait, because good things happen to those who wait. The sacral plexus is going to give me the sciatic nerve, and that's going to be the posterior part of the thigh. The sciatic nerve is made of 2 very big nerves, and these 2 nerves include tibial nerve and common fibular nerve. The tibial is the medial one, whereas the common fibular or common perineal nerve is the lateral one. How about the famous pudendal nerve, which accompanies the internal pudendal vessels in the pudendal canal? Oh, that's also part of the sacral plexus. We've talked about the lumbar plexus in detail in my video on the lower extremities, but let's review. Lumbar plexus from L1 to L5, anterior primary rami, ilio-iliogenito lateral femoro-optio, ilio-iliogenito lateral femoro-optio, ilio hypogastric, ilio-inguinal, genito-femoral, lateral femoral cutaneous nerve, also known as lateral cutaneous nerve of the thigh, femoral nerve, obturator nerve. This is the anterior nerve of the thigh. This is the famous medial nerve of the thigh. And then later the sciatic nerve is going to come from the sacral plexus, and that will be the posterior nerve of the thigh. Let's talk about the sacral plexus from L4 to S4. Anterior primary rami, of course. Superior gluteal nerve, inferior gluteal nerve, and the piriformis. And then the 2 famous nerves in the sciatic nerve, which are the common fibular nerve laterally and the tibial nerve medially. I said that the lumbar plexus came from the anterior primary rami, and the sacral plexus also came from the anterior primary rami. But what in the French toast is an anterior primary ramus? Well, if you take any spinal segment, this could be L1, L2, L3, S1, I don't care. This is just a segment of the spinal cord. You will recall that this is the dorsal root, but this is the ventral root. And then together they join forces to give me 1 spinal nerve. 1 on the left and 1 on the right, of course. Each spinal nerve, after uniting, is going to divide again. Backwards, it's called the dorsal ramus, also known as the posterior primary ramus. This one is the ventral ramus, also known as the anterior primary ramus. The dorsal primary ramus is nothing, and that's why we don't care about it. Just some skin and some muscles of your back. That's it. But most of the viscera, all of the action is from the anterior primary ramus. And that's why the brachial plexus, anterior primary rami, of C5, C6, C7, C8, and T1. Lumbar plexus, also anterior primary ramus, of L1 to L5, or all of the lumbar segments to be specific. And the sacral plexus is also anterior primary ramus, of L4 until S5. Again, the 2 famous nerves of the lumbar plexus are obturator and femoral. The 2 famous nerves of the sacral plexus are the sciatic and pudendal. The sciatic is made of 2 nerves, common fibular, which is lateral, and tibial, which is more medial. Don't ever forget that the nipple is at the level of T4, the umbilicus is at the level of T10, dermatome, and Socrates' anal os is at the level of S4, or you can say S3 and S4. So T4 is the nipple, T10 is the umbilicus, and S4 is this anal os. Look at this beauty. Lumbar plexus, iliogenito, lateral femoro-optio. Amazing. Remember vein, femoral artery, femoral nerve. To learn more about the femoral nerve and the femoral vessels, please refer to my video on anatomy of the lower limbs. The sacral plexus is made of a plexus of nerves. They emerge from the anterior sacral foramina, if you remember. The obturator nerve, just like the obturator vessels, is going to enter the obturator canal in the obturator foramen above the obturator membrane. You have a lumbar plexus and a sacral plexus of nerves, which are made of the anterior primary rami of lumbar and sacral spinal segments. The sacral plexus gives us two terminal branches. One of them is the sciatic nerve, the other is the pudendal nerve. The root value of the pudendal nerve is S2, 3, and 4. Here is a view of the pelvis and the perineum. This is a coronal section. Here we have the obturator foramen. This is part of the hip bone. This is obturator internus muscle. Then there is the pelvic floor, made mainly by the levator ani muscle. The superior surface of levator ani supplied by S4 segments, whereas the inferior surface of the levator ani supplied by the pudendal nerve. Where do I find the pudendal nerve? You find the pudendal nerve inside the pudendal canal, accompanied by the internal pudendal artery and the internal pudendal vein. If you have watched my video on the arterial supply of the pelvis, you should recall that the internal pudendal artery is a branch of the internal iliac artery. Where did the pudendal nerve come from? The answer is from the sacral plexus. What is the root value of the pudendal nerve? It's S2, 3, and 4, meaning the second, the third, and the fourth sacral segments. The pudendal nerve is one of the two terminal branches of the sacral plexus. What's the other terminal branch of the sacral plexus? The answer is sciatic nerve. Before the pudendal nerve was in the pudendal canal, the pudendal nerve left the pelvis through the greater sciatic foramen, then entered into the lesser sciatic foramen, and then entered into the pudendal canal. What are the branches of the pudendal nerve? The three branches of the pudendal nerve all arise in the pudendal canal, and these are inferior rectal nerve, perineal nerve, and the dorsal nerve of the penis or the clitoris. Let's start with the inferior rectal nerve. What does it supply? Of course, it supplies the anal canal below the pectinate line. It also supplies the external anal sphincter and the inferior surface of levator ani muscle. Next, we have the perineal nerve, which gives muscular branches to all of the perineal muscles. And in males, it will give us posterior scrotal nerves for the scrotum, and in females, it will give us the posterior labial nerves for the labia majora. Then we have the dorsal nerve of the penis in males and the dorsal nerve of the clitoris in females. This is one of the structures that pierces the perineal membrane. This nerve will supply the skin of the body of the penis and the glans penis, or the skin of the body of the clitoris and the glans clitoris. Where do we find the pudendal canal? The pudendal canal is about here. So in the beginning, we had the pudendal nerve, which arises from the sacral plexus. Then the pudendal nerve leaves the pelvis through the greater sciatic foramen, crosses the sacrospinous ligament, re-enters again through the lesser sciatic foramen, and then passes through the pudendal canal, accompanied by the internal pudendal artery and vein. And then it gives us the three branches: inferior rectal nerve, perineal nerve, and the dorsal nerve of the penis or clitoris. Well, look at that. This is the piriformis muscle. Above it, superior gluteal artery. Below it, inferior gluteal artery. This is the internal pudendal artery and is going to enter into the pudendal canal together with the internal pudendal vein and the pudendal nerve. What's the name of this nerve at the back of the thigh? Sciatic nerve. The pudendal nerve follows the internal pudendal artery. Here is the internal pudendal artery with the pudendal nerve in the pudendal canal. There is a pudendal canal on the left and another on the right. What separates superior gluteal from inferior gluteal? The famous piriformis muscle. Please take a moment to pause and review. This dorsal nerve of the penis or clitoris is going to pierce the perineal membrane. So let's talk about the perineum. What does the word perineum mean? Perineum means perianal, around the anal os. If you have watched my video on the anatomy of the pelvis and perineum, you will remember the structure of the perineum. As we have said before, the perineum looks like a diamond. The world is my oyster, but the perineum is my diamond. Then you divide this diamond or this rhombus into an anterior triangle and a posterior triangle. The anterior triangle is known as the urogenital triangle, which contains the perineal membrane. The posterior triangle is known as the anal triangle, which contains the anus. Anteriorly, you have the symphysis pubis. Posteriorly, that's the sacrum. On both sides, the ischial tuberosity, which is the bone that you sit on. Transversely, we have transversus perineae muscles. Between the symphysis pubis and the ischial tuberosity, we have the pubic arch, also known as the ischiopubic ramus or inferior pubic ramus. This angle is narrow in males but wider in females to allow more space for childbirth. Between the ischial tuberosities and the sacrum, we have the sacrotuberous ligament. Recall that the anterior triangle is the urogenital triangle. It is floored by perineal membrane. The perineal membrane in males was pierced by the following structures. It was pierced by the urethra, the ducts of bulbourethral gland, the artery of the bulb of the penis, the deep artery of the penis, dorsal artery of the penis, and dorsal nerve of the penis. The exact same structures exist in female, but instead of saying the deep artery of the penis, we're going to say the deep artery of the clitoris, dorsal artery of the clitoris, and dorsal nerve of the clitoris. And instead of ducts of bulbourethral gland, we'll have the vagina. Here's a quick reminder that the dorsal nerve of the penis is a branch of the pudendal nerve. And there you go, the female structures piercing the perineal membrane. They include urethra, vagina, artery of the bulb, deep artery of the clitoris, dorsal artery of the clitoris, and dorsal nerve of the clitoris, which is a branch of the pudendal nerve. Now let's take a cross-section in the male organ. What you'll see is this, a face smiling at you with two eyes and one mouth. The two eyes are the corpora cavernosa. Why do you call it corpora? Corpora is the plural of corpus. Corpus means body, as in corpse. There is a city in Texas called Corpus Christi. What does that mean? The body of Christ. So corpus means body. Okay, why cavernosa? Cavernosa because it's filled with caverns. Caverns means caves, dilated cavities that will then get filled with blood during erection. Don't forget that your parasympathetic is pro-erection, not the sympathetic. I hope you still remember the mnemonic that the parasympathetic points, #erection, whereas the sympathetic nervous system shoots, #ejaculation. Back to the corpora cavernosa. They are caverns, they are empty spaces that can get filled with blood. When they get filled with blood, the male member becomes engorged and hardens. But even after it hardens, the ventral part, which is the corpus spongiosum, remains relatively soft. The urethra is in this corpus spongiosum. What separates the right corpus cavernosum from the left corpus cavernosum? A septum in the middle. And then on the dorsal aspect of the penis, we have dorsal veins of the penis, dorsal artery of the penis, and dorsal nerve of the penis. On the outside, there is skin and then superficial fascia and then deep fascia. But be very careful. The superficial fascia of the penis does not have any fat. It is devoid of fat. And that's why when males become morbidly obese, their penis never becomes obese. Because this covering of the penis does not have fat. Unlike the anterior abdominal wall, for example. There is fat in the anterior abdominal wall. So if I become obese, more fat will pile up in my anterior abdominal wall, but no fat will pile up here. Quick note, the penis is the male organ of copulation and micturition. The equivalent to the penis in females is the clitoris. That's the embryological equivalent, but the clitoris in females is not the organ of micturition and it's not the organ of copulation. The organ of copulation in females is the vagina. The organ of micturition is the female urethra. The dorsal nerve of the penis and or the clitoris is a branch of the pudendal nerve. And here is the sacral plexus again. The genitofemoral nerve is going to give us a femoral branch and a genital branch for the genitalia. You can learn more about the lumbar plexus and the sacral plexus in my video titled The Lumbosacral Plexus, which you can find in this anatomy playlist. Do you see those nerves of the pelvis and the perineum? These are mainly somatic nerves, which means voluntary. But how about the autonomic nervous system? Next, autonomic innervation for the pelvis and the perineum. And let's do the abdomen as well. You will remember that the autonomic nervous system is made of what? Oh, sympathetic and parasympathetic only. That's a bunch of nonsense. Sympathetic, parasympathetic, and enteric nervous system. If you do not know what the enteric nervous system is, please watch my gastrointestinal physiology series, which you can find in my physiology playlist. This is the brain, this is the spinal cord. Sympathetic was thoracolumbar, but parasympathetic is craniosacral. Let's start with the parasympathetic because it's easier. The parasympathetic nervous system, craniosacral. Cranial what? Only cranial nerves number 3, 7, 9, and 10 have parasympathetic function. 3 is the oculomotor, 7 is the facial, 9 is the glossopharyngeal, and 10 is the vagus. 10 is a very important nerve. It supplies stuff in your head and neck, thorax, and all of the abdomen, but not the pelvis. Where is the distinction between the abdomen and the pelvis? Let me tell you, it's the same distinction as between the midgut and the hindgut. Where is that distinction? It's between the proximal 2/3 and the distal 1/3 of the transverse colon, just close to the splenic flexure. This is where the vagus nerve ends, because the vagus nerve is going to supply the esophagus, the stomach, the duodenum, jejunum, ileum, ileocecal valve, cecum, ascending colon, hepatic flexure, and the proximal 2/3 of the transverse colon. And then the vagus will stop there. Who's going to take over? Craniosacral. Oh, the pelvic nerve, the pelvic splanchnic nerve, which came from S234. Parasympathetic points. Hashtag erection. Who caused that erection? S234, keep the penis off the floor. So the parasympathetic supply to the pelvis and the perineum is mostly done by this amazing pelvic nerve. It's not actually one nerve, it's a bunch of nerves. We call them pelvic splanchnic nerves, or pelvic nerves, or nervis erigentes. Erigentes from erotic. And that's it for the parasympathetic. As for the sympathetic supply to the abdomen and pelvis, it's thoracolumbar. Okay. Thoracolumbar, sympathetic supply for whom? For abdominal and pelvic viscera. And in order to minimize the points at which we're gonna pierce the viscera, sympathetic saw those vessels and said, hey, celiac trunk, where are you going? I'm going to the foregut. Why don't you take me with you? Okay, so some sympathetic fibers are gonna emerge from these thoracic vertebrae. They're gonna relay not in these paravertebral ganglia, but in prevertebral ganglia, also known as collateral ganglia. You can also call them pre-aortic ganglia, so to speak. And then some sympathetic fibers are going to join the celiac trunk to go to the foregut organs. Some sympathetic fibers are going to join the superior mesenteric artery to the midgut organs. And some sympathetic fibers are going to join the inferior mesenteric artery to the hindgut organs. When you hear the word greater splanchnic nerve or lesser splanchnic nerve, or hypogastric nerve, these words imply sympathetic for the most part. So let's review the parasympathetic first. All right, I'm going to the foregut. What's the parasympathetic? Oh, vagus. Amazing. What if I'm going to the midgut? Still vagus. One on the right, one on the left. Remember that the right and left vagus changed names into posterior and anterior vagi. Okay. Now I'm going to the pelvis. I'm going to the descending colon, sigmoid colon, the pelvic viscera, etc. Then S2, 3, 4 are gonna keep the penis off the floor. So from the hindgut on, it's all gonna be pelvic splanchnic nerves, or nervi erigentes. That's the parasympathetic, which is the easy part. Now let's talk about the sympathetic. For the foregut, I'm gonna follow the celiac trunk, hence celiac plexus of nerves and celiac ganglion. Yes, it's mainly for the sympathetic, but the parasympathetic is gonna join forces. Okay, you can come with us. And then these autonomic fibers are gonna follow the Mr. Beast rule. Double it and give it to the next person. Okay, so from the celiac plexus and celiac ganglion, double it and give it to the aortic plexus, also known as intermesenteric plexus. What does intermesenteric mean? Between two mesenteric. What are the two mesenteric? Superior and inferior mesenteric. Oh, got it. And then what? Double it and give it to the next person. I'm gonna give it to the superior hypogastric plexus. And then what? Give it to the hypogastric nerves, which are gonna give it to the inferior hypogastric plexus. Okay, but how about the sympathetic supply? Celiac, still celiac. Remember, we are thoracolumbar for the sympathetic, so some thoraco and some lumbar fibers. Then double it and give it to the next person. Celiac plexus will give it to the celiac trunk. Celiac trunk will give it to the aortic mesenteric plexus, which will give it to the nerves around the inferior mesenteric artery, gonadal artery, and iliac arteries, which will give it to the superior hypogastric plexus, which will give it to the hypogastric nerves, which will give it to the inferior hypogastric plexus, which will give it to the pelvis. And now on to the finale. Here is a quick note on the inferior rectal nerve, which is a branch of the pudendal nerve. This is the most important slide in the entire stinking lecture. Anal canal above the pectinate line versus below the pectinate line. When it comes to arterial supply, above the pectinate line, we have the superior rectal artery, which is a branch of the inferior mesenteric artery, and the middle rectal artery, a branch of the internal iliac artery. But below the pectinate line, the anal canal is supplied by the inferior rectal artery, which is a branch of the internal pudendal artery, which accompanies the pudendal nerve in the pudendal canal. How about the venous drainage of the anal canal? Above the pectinate line, we have the superior rectal vein, which drains into the inferior mesenteric vein. This is portal. We have the middle rectal vein, which drains to the internal iliac vein, which is caval. And below the pectinate line, the anal canal drains to the inferior rectal vein, which drains to the internal pudendal vein, which accompanies the internal pudendal artery and the pudendal nerve in the pudendal canal. This is caval. As you notice, the anal canal is one of the sites of portosystemic or portocaval anastomosis that is going to open up if I have cirrhosis of the liver and portal hypertension. Third, as far as lymphatic drainage is concerned, above the pectinate line, the anal canal drains to the internal iliac group of lymph nodes, because the proximal part of the anal canal belongs to the pelvis, whereas the distal part of the anal canal belongs to the skin, and the skin is superficial, and that's why it's going to drain to the superficial inguinal lymph nodes. Finally, when it comes to innervation, above the pectinate line, this is autonomic innervation, which means it's only sensitive to stretch. It's not sensitive to pain, touch, pressure, or temperature. Only sensitive to stretch, because this is visceral autonomic innervation. Okay, where did those autonomic fibers come from? From the inferior hypogastric plexus. All right, where did that come from? From T12 to L3. Remember, it's thoracolumbar. And of course, the pelvic splanchnic nerves are gonna join forces. But below the pectinate line, these are not autonomic fibers anymore. These are somatic fibers. And because they are somatic, they are sensitive to pain, pressure, temperature, and even touch. These somatic fibers came from the inferior rectal nerve, which came from the pudendal nerve, which accompanies the internal pudendal vessels in the pudendal canal. Where did the pudendal nerve come from? It came from the sacral plexus. S2 to S4. Remember that the two famous nerves of the sacral plexus are 1. Sciatic nerve and 2. Pudendal nerve, S2 to S4. Above the pectinate line, visceral, autonomic, I cannot feel pain. But below the pectinate line, somatic, which means I can feel pain. And that's why we teach surgery students that internal hemorrhoids bleed, but external hemorrhoids hurt. Who else is gonna teach you like this? Your professor with his PowerPoint? Give me a break. To learn more about the differences between somatic pain and visceral pain, between the differences between A delta nerve fibers and C nerve fibers, to learn about the mechanism of the gate theory of pain and how acupuncture works, and other methods to mitigate the pain, watch my video titled Pain, which you can find in my neuroanatomy playlist. You can also find it in my physiology playlist. You can learn more about the pelvis and perineum if you watch my In 90 Minutes Quick Review playlist. If you want to learn about pregnancy, the normal changes of pregnancy, the complications of pregnancy, if you want to learn about parturition, childbirth, the complications that happen in the peripuerium, and the puerperal sepsis, i.e. peripartum sepsis, liver disease during pregnancy, heart disease during pregnancy, endocrinal diseases during pregnancy, and much more, download my obstetrics and gynecology high yields course at medicosisperfectionalis.com. It comes with videos, notes, and cases. It will also teach you about breast cancer, ovarian cancer, uterine cancer, cervical cancer, vaginal cancer, and vulvar cancer. To learn about all of the drama that takes place in your kidneys, proximal tibial, loop of Henle, distal tibial, collecting ducts, etc., download my kidney physiology course on my website. To learn about insulin, glucagon, testosterone, estrogen, progesterone, cortisol, and more, download my endocrine pharmacology course on my website. To learn about diuretics, digoxin, the antihyperlipidemics, antiarrhythmics, anti-anginal drugs, and antihypertensives, download my cardiac pharmacology course. There are more than 750 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.